I'm the buyer. I make all the decisions. I get to decide. Really? Hello, my friends. Welcome to another episode of the Medical Sales Guru podcast and the Medical Sales channel on YouTube. I am so glad you are here. Let's get into it. Has it ever happened to you where you're closing a sales conversation and the prospect says, this really isn't my decision. And they start to list off some of the other people that you need to talk to, or they have to talk to, or maybe they're going to tell you that you have to get in front of the VAC, the VAC, the Value Analysis Committee. If this hasn't happened to you in healthcare, then you are not paying attention, because there is almost always additional decision makers. Used to be that we had the clinical decision maker, and the clinical decision maker can make the call. Boom, I want to use this product. I want to use this service. But that has shifted quite a bit. Very often, there is another decision maker. Now, that's not to say that there are situations where you will just be dealing with one decision maker. But you want to find out up front, or as close to the front as possible of the sales process, whether or not you are going to be dealing with more than just one person. It's better to find out than to spin your wheels for weeks or months trying to close the sale and nothing happens. You don't want to spend time with the wrong people. So how do you do this? How do you find out if there's more than one person involved? Exactly. Ask. That's exactly what you do. So when is the right time to ask? Well, there's no perfect time, almost any time. But really the best time is up front if you can. You could say something along the lines of, Dr. Smith, does the hospital give you the freedom to use whatever surgical staplers you prefer? Listen to the answer and then ask clarifying questions. For example, if Dr. Smith says, well, they prefer I use the one that's on contract at the hospital, you could then say, Doctor, I understand. But let me ask you, if you wanted to use a different product because it would be a better choice for the patient or the procedure that you're doing, could it be worked out? Would they allow it? You see, you want to know who it is. Now, at this point, by the way, just asking that question, you're probably making the prospect curious. Why are you asking this? But just setting this expectation up front is going to make it easier to reintroduce it down the road after you've had your sales conversation. Because you might want to say something like, would you like me to speak to someone at the hospital to find out how you could use this product that we just discussed? Who should I talk to? You see, what are you doing? In the first part, you asked if he would be allowed to use whatever product he wanted. It's a clinical decision. If I deem that this is better for my patient, if it's going to be easier for me, if it's going to save time in the operating room, if it's going to be less costly for the hospital, for the patient, can I use this product? And then at the end, you want to say, is there someone you'd like me to speak to at the hospital, at the clinic, in the office to make this happen? So you're finding out if there's other people involved in the sale. Now, here's something that's really cool. Whoever this other person is, and there's almost always going to be other people, you might struggle to try and get to this person on your own, by yourself. But the prospect you're talking to, someone who has some clout, someone who has some power, someone who has some influence, they could make it happen. So why not ask them if they could help you? Ask the customer to help you to get to that person. You could say, Dr. Smith, could you email Margaret in the operating room and tell her that you asked me to speak with her, that you and I talked? I can't always gain access to Margaret. She's very busy. A lot of times she doesn't answer the phone calls. She doesn't return my voicemails. So could you just send her an email or drop her a line, or when you see her next time you're there, just ask her that you're going to tell her that you're going to send me over and ask her if she'd spend a few minutes with me. It works great because if the doctor asks or someone of influence, that person is likely to acknowledge. They'll spend time with you. There is almost always someone else who's going to be involved in a medical sales process. Find out who it is as early as possible and then ask the customer to help you to get to that person. It's what the pros do. Another thing pros do is to make sure that none of their competitors are more skilled or prepared than they are. As you might have guessed, there aren't all that many pros. There really aren't. I'm talking about the top 1%. Most reps will defer opportunities to improve their knowledge and skills to another time when it's more convenient or when the company will provide that information or pay for the information. The best of the best don't wait. They don't defer. They take action on every opportunity. That's why they're the best. And for the last 3 years, some of the best have been investing in Medical Sales Academy. Medical Sales Academy is my online 365, 24/7 sales training and support platform for medical sales professional. Imagine what it would be like to approach doctors and other healthcare professionals in ways that automatically makes them curious, helps them lower their guard, makes them want to know more about what you're talking about, what you offer. And imagine if you knew how to stay in control of the conversation in a way that they're comfortable with, that they're enjoying because they're learning and it's helping them to feel good about you. If you'd like to learn how you could do this, which by the way is what we teach at Medical Sales Academy, please go to medicalsalesacademy.com. It's right here on your screen, medicalsalesacademy.com, and find out how you can get involved and elevate your level of skills in healthcare sales. I want to thank you for spending some time with me on this episode of the Medical Sales Guru podcast. And don't forget that whatever you do in your medical sales career, the patient always comes first. Think about the patient. Focus on the patient. Let the customer know that this is why you do what you do. Good things will happen, and it's why you do what you do. I look forward to speaking to you again soon. My name is Mace Haroff, and until then, go out and do something great. Bye for now.